World Health Organization is warning the Ebola outbreak in eastern Congo is spreading faster than health officials can contain it, with cases now reported in Uganda. The death toll has climbed above 200 and cases have surged in just the last week. This comes as violence, supply shortages, and global health funding cuts complicate response efforts.
Yeah, joining us live is Dr. Céline Gounder, CBS News medical correspondent and editor-at-large for public health at KFF Health News. Thank you so much for being with us this morning, Dr. Gounder.
It's a pleasure to be here.
Yeah, so you worked on the ground during the largest Ebola outbreak in history. Give us insight into what health workers are facing right now in the Democratic Republic of Congo.
Well, some of the challenges on the ground are that you have a collapsing healthcare system. It was weak before. It was also being supported by USAID. USAID was dismantled last summer. And so basic things like supply chain, getting your gloves, your masks, your gowns, having adequate supply of those, having adequate supply of just basic pharmaceuticals, drugs. A lot of that is really not functioning right now. And so as a result, healthcare workers have already been under tremendous strain. We're also seeing many healthcare workers getting infected and some even dying as a result of this Ebola outbreak. So that very much parallels my experience. The other issue we're seeing is people resisting efforts to control the outbreak. And it's really nothing unique to this particular population. We saw in the US, people did not want to wear masks during COVID. We even saw masks being burned. We saw people not wanting to get vaccinated. And it's very similar, the psychology of this, of not wanting to undergo the contact tracing, the testing, the quarantine, the isolation. We've seen some Ebola treatment units burned and healthcare workers attacked. And it just makes the entire situation more challenging. Again, very similar to what I saw as an Ebola aid worker myself during the West African outbreak over 10 years ago now.
Well, you know, we were talking in the break, and you just brought up something. During COVID, there was contact tracing, and people for a while felt a little bit better until we realized how quickly people can kind of get in and out of different places. Contact tracing here has become extremely difficult in the outbreak, and that's really an important piece of containing this, isn't it?
Well, in particular, because there is no vaccine for this particular species of Ebola, there's no specific treatment. So all you really have at your disposal are the basics. So contact tracing, you identify all the people who have had contact with a person or other potential exposures. You follow them for 21 days. That's the incubation period time of exposure to what is the latest somebody might develop Ebola. So you follow them for the 21 days. Are they having symptoms? You test them if they have symptoms. You try to keep them away from others if they develop symptoms. And if they are diagnosed with Ebola, to get them to an isolation and treatment unit so that you can help them survive the illness.
We do also want to talk about funding cuts to USAID. How has this impacted the response here?
Yeah, this is a major problem. So the fact that the people doing the contact tracing, they were being funded, their salaries paid for by USAID. And so only right now, 1 in 5 contacts are being traced and followed, which means 4 out of 5 have the potential to be the next chain of transmission. So this is a really potentially explosive situation, and we just don't have the resources on the ground to contain it.
You know, before we let you go, the DRC is set to play in the World Cup here in the U.S. next month. Supporters expected to travel from the impacted region as well. How worried are officials about this becoming a spreader event? I know it's not as easy to get as something like COVID, but is there concern here?
I'm not so concerned about Ebola per se. And, you know, it's interesting, the DRC, the soccer team itself has been in Belgium for months. They are not at risk of Ebola or bringing Ebola over here. What does concern me are other infectious diseases. 0 additional federal dollars have been put into bio preparedness, so health preparedness for the World Cup. There has been some $625 million invested in law enforcement or security, but that's not the only kind of security we need to be concerned about. You know, and if I would say what's top of my list of concerns, it would be something like measles or MERS, which is another coronavirus, comes from the Middle East. Those would be top of my list of concerns for a super spreader event at the World Cup.
Okay, well, Dr. Céline Gounder, thank you so much for being with us this morning and breaking this all down. It's appreciated.
My pleasure.